WOVU LP Cleveland.
Stand up.
Issues out of black and white. Let's concentrate on right and wrong.
And now, our voices today.
Why are we led by our pride?
Hi, welcome to the program. This is Our Voices Today on WOVU 95.9 FM Burton Bell Carr Community Radio, streaming live from WOVU.org and the WOVU mobile app. Make sure you have it downloaded on your mobile device of choice. Still haven't found out if it's on. You can put it on your smartwatch. You probably can. So anyway, if you know that for a fact, send me a text on the WOVU talkback line 216-200-7848 216-200-7848. I hope that everyone is feeling good. I am TC Lewis. Hope you're feeling good and feeling well. Hope you had a chance to drink some clean, fresh water today. I hope you had a chance to eat some tasty and nutritious food. Hope you had some good rest the night before, so we're thinking positive and productive thoughts as we move through this day and every day, spreading that good love all throughout the community. Good vibrations and high life conditions. I had a thought because there are a lot of changes are abound, good things, challenging things, but no matter what, I like to think that the joy is in the process of getting through the process with grace and inside of an elevated life condition. So like everything is a process, from one goal to the next. Getting there, the in-between part, is the challenge. But that's the longest part. So you have to find joy in the long parts with grace and it's better if you can do it with an elevated life condition, however you elevate your life condition, So that was just a thought. What do you think? WOVU talkback line 216-200-7848. We always want to hear your voice. Let's see. Make sure you make your way out to the Minority Men's Health Fair, brought to you by Metro Health and the wonderful Dr. Charles Modlin. He is the medical director of the Office of Diversity, of Equity and Inclusion at Metro Health, and also urology doctor, kidney surgeon, taking care of kidneys all across Cleveland and perhaps the world, Dr. Charles Motlin. So at 3 locations, Cleveland Heights, main campus, I think Broadway or Brooklyn. We'll hear that later for sure. But definitely Cleveland Heights location, the main campus location, and either Brooklyn or Broadway. It's a B. So our health is our wealth. Our health is our wealth. I walked out the door yesterday without my athletic greens. I took them later, though. I went to the West Side Market. Wow. What an interesting place to go there as an adult. I went maybe twice as a child. Oh, well, okay. Yeah. Once as a kid, like on a field trip back when it was bustling. Okay. It's not bustling today, but it's a nice, maybe it depends the day of the week you go, but it's a nice, shopping experience, market experience, and a lot of deals. People trying to throw deals. They are always throwing samples. You can go to the West Side Market hungry, and you'll leave full for free because all of the produce vendors want you to taste their wares. Cotton candy grapes, hot, are very hot. Beware though, they're not real food. They don't come from seeds. They are they're derived in a lab and then planted in the ground. Cotton candy grapes. It's weird when so-called real food growing out of the ground tastes like fake food, like candy. You got to be careful, okay? And you know those things have very elevated sugar content. How do you get the cotton candy flavor to grow in a grape? Some type of chemical. You got to be careful. But anyway, also cotton candy grapes, very expensive, $5.79 a pound. Also something called red candy grapes. Adding sugar to an already sweet thing genetically. So I think those are, correct me if I'm wrong, genetically modified grapes. Because how can it taste like cotton candy? It's not even a natural flavor. But still a good time. Got lots of strawberries, blackberries, $10 for the family size carton. Pay now or pay later. Okay, West Side Market, very good. Also, we went on the meats and delectables side of the market, and we got some Buckeyes, delicious, and saw other various sugary treats. Man, you can have a lot of fun on a eating cheat day at the West Side Market. It's a good place. Shout out to Mayor Bibb for making efforts to keep it alive. A lot of construction going on over there. It's a good, if you just need something to do, take the kids to the West Side Market. So, all right. So that's my thing. So my refrigerator is full of zucchini and onions and strawberries and grapes. And I feel rich. Whenever I have a stocked refrigerator, I feel rich and healthy. All right. So today we have, we're going to take a break. We have some wonderful guests. It's another edition of Life and the Law coming up here on Our Voices Today with our friends from Legal Aid. Shout out to Aaron for helping to curate these wonderful conversations. Aaron Horan. Got to get that title on there. But she's a communication extraordinaire in the building today, along with Jennifer Kinsley Smith and Liz Latner from Legal Aid, and from St. Vincent Charity Medical Center, Allison Jakubowski. We're going to find out if I pronounced that correctly when we come back with those voices. We're going to be talking about the medical legal partnership program. All right. Stay tuned. Life and the Law, conversations about your rights with our friends from Legal Aid Society of Cleveland Medical Legal Partnership Program. We'll have them when we come back. It's Our Voices Today on WOVU. I'm still happy. Are you happy? Are you having fun? Please have some fun. I will do it on your behalf, but it's also important that you do it as well, okay? Find the joy, All right, we'll be right back. WOVU 95.9 FM.
Excuse me, but I get so mad. Where could we have been? What could we have had? Yeah, it's time to lose those shackles and break those chains.
From the WOVU Newsroom, I'm TC Lewis. Metro Health and Dr. Charles Motlin, Staff Urologist and Medical Director for Diversity, Equity, and Inclusion at Metro Health, will present the 2022 Minority Men's Health Fair on April 28th at 5 p.m. Geared towards men of color, the event will offer 30 free health screenings, including screenings for diabetes, high blood pressure, and kidney function. The community can take part in the health fair at Metro Health's Broadway, Cleveland Heights, and main campus locations. The event is free and registration is encouraged. Visit metrohealth.org for more information. From the WOVU Newsroom, I'm TC Lewis.
Yo, Siri, who has the hottest app in the city?
WOVU 95.9 FM.
Siri, tell them why WOVU 95.9 FM got the hottest app right now.
WOVU streams at 192 kilobits per second, giving the best sound in the city.
WOVU has a new sound coming out our app right now. The only one in the city, 192 kilobytes per second. Listen, man, it is going down. That's what you're telling me, Siri?
That's right, DJ Chris Styles. You already know what it is.
Listen, check out our new sound right now. Go to your mobile store app, download WOVU 95.9 FM and check us out right now. Tell everybody, listen, we coming at you. This is the Burton Bell Carr Community Radio Station. You already know what it is.
Stand up, my people. Stand for something in your life. Stand up, my people.
All right. We are back. Our voices today on WOVU 95.9 FM. Oh, Erin's gone. All right, I missed her. She shout out to Erin. She's probably listening. Life and the Law is where we are today. Conversations about your rights, our rights, with some members, our friends, not just members of the legal aid organization, but our friends, okay? And we have some new friends talking about medical legal partnerships. We will find out what the heck that is. Jennifer Kinsley Smith and Liz Latner are here from Legal Aid, attorney and paralegal, respectively. Also, Allison Jakubowski, a social worker at St. Vincent Charity Medical Center. Let me turn their mics on so that we can hear them. Welcome, ladies.
Thank you for having us.
Yes. Welcome. So let's do our due diligence and just have each of you say hello to our wonderful WOVU audience and tell us a little bit about yourself and the work that you do. Allison?
Sure, I can start. I'm from St. Vincent Charity Medical Center, the outpatient behavioral health clinic. I'm a licensed independent social worker, and I'm in a care coordinator role. Care coordination primarily means doing like a needs screening with our patients to try to link them to resources that are going to benefit their lives, help them live more full lives, beneficial lives, meaningful lives. So a lot of that is access to food. A lot of that is health insurance, a job with a living wage, affordable housing, things of that nature. The short Cliff Notes version is I essentially help our patients get what they need as a social worker.
That's important.
Yeah.
Yeah. All right. Thank you. Welcome.
Thank you. Thanks for having me.
Allison Jakubowski. All right. So, Jennifer. Yes.
Hello.
How are you?
I'm good. How are you?
Welcome.
Thank you.
Tell us about yourself.
Sure. My name is Jen. I'm a senior attorney at the Legal Aid Society of Cleveland. I have been with our medical legal partnership at St. Vincent for the last 4 years. Mm-hmm. So my job is to address the civil legal needs of the patients of St. Vincent Charity, and I do that with the help of Liz Latner.
All right.
Hey everyone, I'm Liz. I am the paralegal that works with Jen at the St. Vincent Charity Medical Center Medical Legal Partnership. I have been at Legal Aid and the St. Vincent MLP for about 2 years, and my main job is just to support Jen and get the patients what they need, kind of like Allison. We work together a lot, so you might hear a lot of us going over the same things. But yeah, we're all here to just support the St. Vincent patient population.
Okay, awesome. So, addressing the civil legal needs of patients within the St. Vincent Charity Medical Center population. Great. So let's dive right in. We're talking about medical legal partnerships. I think we can kind of get an idea as the three of you have introduced yourselves of what it actually is, but give us the bare bones definition, any of you.
All right, so a medical legal partnership, I'm just going to call it an MLP because it's a mouthful.
Yeah.
So an MLP is a service delivery model where legal teams can partner with healthcare providers to address the health-harming legal needs of their patients.
Okay.
And legal teams can provide legal assistance to the patients, but they can also provide legal training to the healthcare providers. So if the healthcare providers are seeing a specific type of legal issue come up, the MLP team or the legal team can empower the health center staff to also learn more and know how to screen for those legal needs as well. So, it functions to serve the patients, but also to empower the healthcare center staff.
Okay, so what exactly are the civil legal needs of patients?
That depends. They're largely based off of a social determinant of health model. So the circumstances in which people live and work and play, worship. So if there is any social determinant of health that is impacting someone negatively, that can be addressed through the legal system, that's what we're looking for. So an example would be, my food stamp benefit amount was reduced. My SSI check got cut. I'm being evicted. There's mold in my unit. Any of those things that are causing an adverse health effect that the medical provider can catch would get referred to us to investigate further.
Okay, so anything that becomes a barrier to living a healthy life.
That's right.
I think that's a good way to put it.
Okay, cool. Social determinants of health. Yeah, I remember that from some class at Kent State. So let's see. Tell us about the history, I guess, in general of MLPs, medical legal partnerships, at Legal Aid.
So the concept of medical legal partnership really started in 1993, and it started in Boston. Generally, you see medical legal partnerships serving a pediatric population, and that's because that's where the idea came from. Okay. So initially, a pediatrician at Boston Children's Hospital identified that no matter what medical treatment he provided to his asthma patients, they weren't improving. So he brought an attorney onto the team who was able to determine there was extensive mold in the patient's residence.
Right.
And only when the attorney was able to get the building to fix the mold did the asthma get better. That model is now in 450 hospitals and health centers throughout the country. I think Liz can talk a little bit about how Legal Aid brought MLPs to Cleveland.
Yeah, so the Legal Aid Society of Cleveland actually has 8 different MLPs that are targeted towards different patient populations. So like Jen said, the pediatric model was the first. So we actually have 3 pediatric models in Cleveland, one with Metro Health Main Campus, another with UH-Raybow Center for Women and Children, and then we just started our new MLP, which is at Cleveland Clinic's Primary Care Pediatrics at Main Campus. We have the behavioral health population model at St. Vincent Charity Medical Center, where the 3 of us are. We have 2 outpatient-focused MLPs with Metro Health. One is at the Buckeye Health Center, and another is at the Broadway Health Center. We have Metro Health Collaborative Care Partners, which is all across the Metro sites, and that serves the Medicare population. And then last but not least, we have the Metro Health Ohio City Health Center, which serves the Hispanic population. So we have a lot of MLPs just in Cleveland.
Right, a lot of coverage. It sounds and feels like, and so again, addressing the civil legal needs of patients in those populations. Let's see. So Allison is here with us from St. Vincent because we're going to talk about the partnership between Legal Aid and St. Vincent's and their MLP. How did these things get started? Like what, does St. Vincent say we need help, our patients need help, Legal Aid, can you help us? Or is this kind of like a natural thing that happens between healthcare and the justice system or legal system?
I can jump in and help Allison.
Okay.
So this specific partnership came out of a community needs assessment that St. Vincent Charity did that determined that there were extensive civil legal needs in their patient population. So they did reach out to Legal Aid looking to get a medical legal partnership up and running. And that was in 2017 that we opened the doors to this partnership.
Yeah,
So yes,
cool.
I came on to St. Vincent last summer in June of 2021, so I did not quite know that history.
Ever since she started, she's been a great referrer to the MLP.
Okay.
Yes, so in all of my time at St. Vincent, I've only ever, I've not known what St. Vincent was like prior to the MLP, but I can only picture how challenging it must have been for some of the doctors and other service people to try to link people to that resource. It's so nice having the MLP here at St. Vincent because it's a small team. It's a very personalized touch. Jen and Liz are specifically assigned to work with St. Vincent patients. So it's nice to be able to do a warm handoff, and that way people don't feel like they're being put into like a big system of multiple players and multiple moving parts. Liz will call you, is what I say. Her name is Liz. She will reach out to you directly.
I will call you a few times.
Yes,
Right, yeah.
for sure. So
That's always good to know that there's someone like right at hand.
Correct,
You
correct.
don't have to go through a phone tree and
yes.
And first name basis, you
Yeah.
know, like they know me, they know Jen, they know Allison. I think the reason that Allison sends over such good referrals is her job specifically is to screen for these social determinants of health. So I think that's why, we get such good referrals for you.
I think so. So yes, in the outpatient behavioral health clinic, I have the privilege of like walking with people on their journey. That's how I always kind of phrase it. So I recognize that people come to us oftentimes in a very stressful state. Multiple factors are moving in their lives that are contributing to their mental health symptoms becoming more difficult to manage. So I always like value and the trust that our patients put in us, that they disclose some things that may be embarrassing to talk about or maybe just so hard to share what is preventing them from living the life that they want to live. But then I'm able to jump in and say, I have a plan for you. I know exactly how we can work together to help you enhance your health and overall quality of life.
Yeah. So it sounds like I know Allison, you're a social worker, right?
Yeah.
So and this sounds like what social workers do. Where does the legal part come in? Why do we need legal aid to help us with our food stamps or anything like that? Yeah.
It's a great question. So that's often what's hard for folks to figure out is where does the social work stop and the legal work start? The answer is if it's a resource that social work can provide, they provide that. When it comes to a sticking point for them, for example, if you're being evicted, Allison might be able to help get you financial assistance to get caught up on rent. But there's going to come a point where you have to answer to a complaint, and that's overwhelming.
Okay.
And the eviction process is hard to understand. So that's when Allison will call us and say, hey, this person got a 3-day notice. Let's start working with them. It's always better to have an attorney look at an issue to try and catch something up front than to have the person tell Allison, I got evicted 2 weeks ago, when there's not an opportunity anymore for an attorney to get involved and try to save that housing or save that food stamp check or secure that Social Security benefit.
Thank you for clarifying that. So there could be issues downstream that could lead to the need for the legal help. Very, very interesting. We are here today in the midst of another edition of Life and the Law, conversations about your rights, talking about medical legal partnerships, specifically the one between Legal Aid and St. Vincent Charity Medical Center. From St. Vincent, here with us is Allison Jakubowski. She's a social worker, and she just helps people get what they need. She's working in the behavioral health department. Yes. Clinic. Yep. Okay. And then we also have Jennifer Kinsley Smith, a senior attorney at Legal Aid, along with Liz Latner, a paralegal, also at Legal Aid. And, they help get you what you need in the legal way. So we're going to take a break. If you have any questions for our guests, I'm looking at the phone. You can call 216-271-0959, 216-271-0959, or you can send a text to the talkback line 216-200-7848. Send a text to 216-200-7848. This is Our Voices Today. I'm TC Lewis. You are your wonderful self, and please come back. We'll be right back.
How will we ever know if we were never taught or told to never stop fighting? Don't ever quit just 'cause the rich get rich.
What's up, Cleveland? It's your girl, Jazzy J, and I just want to know, have you downloaded our app yet? Yes, our app for Androids and iPhones. All you got to do is go to your app store and download WOVU 95.9 FM, and you can listen to us anywhere.
WOVU 95.9 FM and Neighborhood Family Practice wants you to know the facts about COVID-19.
COVID-19 is so new. How did they create the vaccine so fast?
The fact is, the technology used to develop vaccines has been tried and tested for decades before the COVID-19 pandemic. Scientists have been building on knowledge from previous vaccines that have kept us from serious illness and death. If you have questions about the COVID-19 vaccine, call Neighborhood Family Practice at 216-281-0872. Keep listening to get the facts on COVID-19 from Neighborhood Family Practice and WOVU 95.9 FM, Our Voices United, Burton Bell Carr Community Radio.
The month of April is National Alcohol Awareness Month. This provides an opportunity to increase the awareness of alcohol addiction in an intense 30-day focus. The observance aims to bring an understanding of alcohol's causes and the effective treatments available. This is also an opportunity for people to share their experiences with alcoholism, recover, and offer support to others seeking recovery. Now, there are many ways to observe Alcohol Awareness Month. One is by practicing limiting your consumption and keeping track of the quantity of alcohol you consume. To be informed about alcohol's impacts on the body, short and long term. Encourage parents to discuss alcohol abuse with their children and talk to your own children too. And healthcare workers can make a concerted effort during the month of April to talk about options with their patients. Help spread the awareness. #Alcohol Awareness Month. This message is brought to you by WOVU 95.9 FM, Burton Bell Carr Community Radio.
It's time to make the short story longer, yeah.
All right, we are back. Thank you, Crazy T, for letting us know about Alcohol Awareness Month, the month of April. Also, as you were saying, Allison, what did you say it was?
What did I say?
Sexual Assault Awareness Month. Yes, I think our friend Imani said that to us the other day. Because, behavior, that's a part of behavioral health, right?
Trauma?
Alcohol.
Oh, yes.
Addiction.
Yes.
Yeah. And so we need to be aware. Okay, sorry. So we are here talking with our friends Allison, Jen, and Liz from Legal Aid and St. Vincent Charity Medical Center about the medical legal partnership between the two organizations. Medical legal partnerships, or MLPs, in general, and there are many across the city, Northeast Ohio, across the country. We said 450 of those exist, and so they basically it's a mechanism to help patients have other needs addressed, and down the line that may lead to the need for legal help and consultation. So that's where Legal Aid steps in once those. Yes, that's where Legal Aid steps in. So we talked about a little bit the social determinants of health, which is what an MLP addresses, the barriers that keep people from living healthy lives or getting access to health care. Is there a general list, or is it just like whatever,
I think there are several.
Okay.
And it's not a new concept, but it's kind of unfortunate that still in 2022 things are just so difficult to change. We are going up against huge concepts like chronic poverty. It might be lack of access to affordable housing. We're in one of the worst periods of inflation in this country's history. That is crippling families, crippling people. So with that, it would be lack of access to like a living wage, lack of access to education. Safety is one that I think we so often overlook. If we're not safe in our neighborhood, how do we navigate it? How do we access those things that I mentioned, like a job or a school system, what have you? So again, they're very kind of big concepts to tackle. Yeah. But I think social workers, that's one of our ethical principles, is to advocate for patients and social justice means. And that's why the MLP is so helpful, because we, I think, have that similar value. Yeah. Because we see this every day. We see these big concepts that are continuing to affect people and individuals on a daily, constant basis.
Yeah. So can we have some examples of how the MLP has worked in the lives of some patients? You guys have some stories for us?
We do. We had a patient come into the outpatient behavioral health clinic for a counseling need, for an individual counseling need. Did not say anything about his housing issues at first, where he was in a unit where there was persistent black mold, and a landlord who was not fixing the issue. Obviously, black mold was getting into his lungs, right, causing worsening health symptoms, causing worsening mental health symptoms. It's all intertwined. It's all intertwined. That particular patient was also looking to separate from a partner who was violent. So there was that issue at hand. And then there was the issue at hand that he struggled with hearing, and oftentimes could not follow up with his medical providers because he just simply did not understand what they were asking him to do. Right. So how I linked them to Jen and Liz, I triggered that referral to them, and then on my part as a social worker, I helped navigate that health system. Let's get you in to see an audiologist. Let's get you, a hearing aid. That way you can speak for yourself in court and make sure that you're advocating best for your needs. You're working with Jen and Liz in a way that's appropriate and getting your needs met. So I think that's a great example of how an environmental stressor was contributing to their mental health and physical health, and how social workers and lawyers, we all work together to help this patient.
Wow.
Yeah, and I think that's a great example of how, one individual patient or client can have like 3 cases open for them.
Yeah.
I mean, that is one of the great things about the MLP is, we can open 5 cases, we can open 1, and we can work on them all simultaneously. And it's really about addressing the whole person and what can really help benefit their health in general instead of just addressing one specific issue.
Yeah, amazing. It's just this highlights just how important all those little details are in your life, and when you don't have those simple things that a lot of us just simply take for granted.
Absolutely.
It just makes a huge difference. So that's one story. We have, I know we have another one that I'm interested in, because we're all talking. Health is just of great import, right? How we feel physically. Somebody was affected by losing their SNAP benefits. I'm seeing.
Yeah, so that individual was referred to us by his primary care provider, who noted that between monthly appointments, the patient had lost more than 30 pounds. And so in inquiring with the patient about what the cause was, or if there was a known cause, the patient shared that his food benefits had been terminated and he didn't understand why. That patient was low vision and hard of hearing, and therefore had trouble reading the notices that had been coming to his house about his benefit. So we did get involved at the Legal Aid Society of Cleveland. We appealed that termination decision. We requested accommodations moving forward that would allow that person to receive large print notices about what was happening, but also individual case management through Job and Family Services to make sure that he understood any notice that came to him, along with a program that would come into his house with warm delivered meals every week, to help him gain and maintain that weight.
Wow. I mean, that is a huge difference in this individual's life. Wow. That's amazing. I'm blown away, like a little bit speechless. But in order to even know that these issues exist, we have to talk to people and listen to them. We're talking about medical this legal issues in the medical arena with patients, but a lot of times, doctor's visits, they're 20, 25 minutes. They're trying to get you in and out. They have a whole day of patients. Doctors don't always have the time or the willingness to pry into, how are you feeling? What are you eating? The nurses do ask you, are you safe at home? Do you have any issues? But we may not be always open to sharing that information. We may not know what's okay to share. We may think we might get in trouble, or our life may change in a negative way. How do you encourage medical staff and patients to kind of be more open and have more of a listening ear and kind of not be afraid?
Yes. I think that can be helped with just time and trust. I oftentimes say that when I first meet a patient, that is only the tip of the iceberg, right? Yeah. That's only what I'm hearing on just a first point of contact. So I think it's certainly helpful to get, patient trust and like buy-in. Once you are an established patient, that's then where we hear a little bit more of the story. And just in terms of helping people advocate for themselves, that's a struggle. I think that's absolutely a struggle where people might not know how to communicate like a huge unmet need that they have. Like you said, there might be fear of, well, they're not going to help me, or what have you.
Or I'm going to get my kids taken away. Or
that's a big one that I especially hear as a licensed social worker. But I'm so sorry, I lost my train of thought.
No worries.
Well, I think sorry. So yes, what I was going to say, I think within St. Vincent, because we are a slight, smaller hospital system, that I think there's certainly the knowledge of the MLP, not only in the outpatient behavioral health clinic where I'm located, but within all of the offices. And since we have such a close-knit community, I think providers are very, very comfortable saying either I'm going to give you the number for the MLP or I'm going to fax this over to Liz, and then they handle it from there.
Yeah, we've really tried to make it as seamless as possible for each individual provider to fit the MLP in however is easiest for them. You know, like Allison might do a full screener because it coincides with, you know, what she's already doing. But, you know, a resident doesn't have that much time. They may just say, we have this MLP, do you want to call them? You know, and it can be as easy as that. So we really try and make it flexible so that any provider, if they hear something, can send someone over without, you know, requiring everyone to, you know, to do it in the same way.
Okay. Legal Aid has partnerships with a lot of entities. I know with CMSD, Cleveland Schools, I think as part of Say Yes.
Say Yes.
Yeah. There's partnership where, you know, families and students, they go to their Say Yes coordinator, and that wonderful individual gets you like Zoom into the process with Legal Aid. Is that the same way with the MLP?
Same.
Yes.
Yeah. Yep. So, and then that's the benefit. And especially when we're on site at St. Vincent, we've had a doctor say, you know, I have a patient who needs surgery today and they're refusing surgery because they have a utility appointment with PIP that they have been waiting forever for. I need to save, you know, this foot. Come into this room right now, and we will come in, do a legal checkup, get on the phone with PIP. And so, I mean, talk about fast track. We'll do it bedside at the hospital, fast track.
Yeah, that's important.
And even not at the hospital, you know, during the pandemic, we had to operate completely remotely. So we were, you know, calling patients. We can call them while they're at the hospital or, you know, on their cell phone. And very often, you know, they have, they're referred, the case is opened, and it's sent to Jen, and she's working on it within 24 to 48 hours. Like, it's very
fast.
Quick.
It's very fast.
Yeah, that's I love that. It's concierge kind of service. But it's the way we're talking about this in this room today, it feels like very warm and fuzzy, you know, like you guys are going to hold our hand and make sure we're okay. But on the outside, we don't know that a lot of us don't know that this exists, that this help, that we can get help, that there is, because when we're in these situations, we do often feel alone. We feel scared, embarrassed, like you said, ashamed. And it can, you know, when you just don't know where to turn, you just kind of go inward or suffer, right? And so how do we make people more aware? I know when they come, that's the point of this, right? When they come in contact with the medical system, then there are people who can recognize the signs of need, right? I guess maybe what is the training side? I mean, I guess you're a social worker, Allison, but what about other staff and medical professionals? Do they get training in how to recognize when maybe an MLP needs to be not enforced, but enacted or used?
So we do I'll just speak about St. Vincent because that's what we know best, but we do provide orientation trainings it's every month, right? So any new hires, they're trained on the MLP during their orientation with the rest of the hospital system. We also do specific legal area training. So if they want to learn more about public benefits, we can host a training, or they can just call us. You know, we're always there just to answer the phone, respond to an email if they want to know something specific. And so we do make ourselves available to all of the areas of the hospital, and we do provide that training and you know, give tools as best as we can about how they can maybe screen. We do a lot of patient examples because we find that you know, it's easier for them to think about it in terms of patients, you know, because they're healthcare providers. And you know, we've done some lectures where we'll do like a little role play, and they'll like fake screen another patient, and that's really been helpful too. So we just try and get creative about, how we can teach them about the MLP, because it's a very unique mindset to get into. And it seems normal for us because we're in it.
Yeah.
But for other
Right.
people, it seems strange.
Yeah.
And I think the other piece of that is to not inquire too much as the medical provider. I am a firm believer in the phrase Liz shared earlier of we have a free attorney on site here who can talk to you about whatever's going on if you would like to talk to her. Because oftentimes exactly what you just said is the truth. Someone isn't sure if their parental rights were terminated by the court. They want to know that answer. They don't want their doctor to know that. So once we start talking, there's attorney-client privilege attached, and I'm not going to do anything that isn't authorized by the client. And so I think that's different. A lot of folks have the unfortunate interaction with attorneys and the justice system where they have no control. In the MLP, every legal step taken is controlled by the client.
Wow.
So they can learn what happened, they can learn their rights and their options. If they want to do nothing with that information, then they've merely been empowered, and that's good enough. But we can also help take it all the way if we have to.
Yeah. And let's reiterate, these are civil matters, not criminal, that legal aid can help with, and for folks who qualify economically, right?
Right.
Yeah. Yeah. So how do you know if you qualify for getting help through an MLP?
So we would just encourage anyone with a health-related legal need to just talk with their healthcare provider about whether there's an MLP that they can be referred to. We do have 8, like I said. We may be growing more. Who knows? So hopefully that there is a MLP where that person receives health care. But if not, they can reach out to legal aid directly at 216-687-1900.
Yeah, 216-687-1900. That's the general intake line. So regardless of what the legal issue is, housing, employment, benefits, safety, food, etc., if you need help, legal aid is there for you. Call their intake line. Again, 216-687-1900. You can also find them online at www.lasclev.org. lasclev.org. We're going to take our last break on this. Excuse me. Ooh, got excited there. On this edition of Life in the Law, conversations about your rights. I saw Erin. She's in and out. She is a busy lady there. She's probably having meetings and stuff, curating other wonderful conversations for other outlets. All right, so we'll be back with our friends from Legal Aid right after these messages. This is WOVU 95.9 FM.
Family First CEC and First Tee Cleveland presents the first annual Back to Golf Kids Fun Day! Saturday, June 25th from 3 to 5 p.m. at the Washington Park Golf Learning Center, 3841 Washington Park Boulevard. This will be a day of play with golf instructions, food, and fun. Parents and or caregivers must be present. Everybody come out here and watch your own kids, and you might learn how to play golf yourself. And the most important thing is, this event is absolutely free. That's June 25th from 3 to 5 p.m. at the Washington Park Golf Learning Center, 3841 Washington Park Boulevard. To register, you can call 216-800-1061. That's 216-800-1061. Come out here and get your Tiger Woods on, y'all. This event is sponsored by Howe Institute, Inner City Youth Golf Academy, Barclay Jones Realty, LLC, Holy Trinity Cultural Arts Center, Another Chance of Ohio, and WOVU 95.9 FM, Burton Bell Carr Community Radio.
What more can I say? I wouldn't be here today if the old school didn't pave the way.
You already know what it is, your boy DJ Chris Dowson. We're giving respect to the old school. It's Throwback Thursday, each and every Thursday, playing the hottest in hip-hop and R&B from the throwback from the 80s, 90s, 2000s, man. We just playing the hits. We're going to make you dance. We're going to make you jump up and down. We're going to make you say, you remember that? Listen, each and every Thursday, WOVU 95.9 FM all day long is giving respect to the old school, giving respect to the throwbacks, giving respect to the time we play that feel-good music. I'm telling you, tune in each and every Thursday from hip-hop to R&B to even those classic reggae records.
Kill 'em with the heads high. Kill 'em with the no. Just make a boy know you're not blow. Heads high.
Check us out, WOVU 95.9 FM. This is Burton Bell Carr Community Radio Station.
It's time to make the short story longer. Yeah.
All right, we are back, and Allison is out. Thank you, Allison, from St. Vincent Charity Medical Center, for joining us today. She's on her way to go help somebody, help them get what they need. We are rounding out this edition of Life and the Law, conversations about your rights with our friends from Legal Aid Society of Cleveland. Jen and Liz are still with us from Legal Aid. Jen is a senior attorney and Liz is a paralegal, and they work together fighting for your civil legal needs. With this MLP, let me turn this down. There we go. MLP Medical Legal Partnership with St. Vincent Charity Medical Center, but 8 other, a total of 8 MLPs with or medical care centers and facilities around the area. So let's see, what have we missed, Jen and Liz? What else do we need to know about MLPs or our rights around medical care? Anything?
I think that one thing is I just want to highlight on what MLPs cannot handle.
Mm-hmm.
So we are unable to handle medical malpractice cases against the hospital that we are partnered with.
Okay.
So if someone is referred to us or contacts us for like medical malpractice or hospital bills or anything like that, where the hospital is the adverse party, we're not able to assist with those cases.
Mm-hmm.
And also criminal cases, like you mentioned earlier, we cannot assist with those. Did I miss anything, Jen?
No, general things that legal aid doesn't help with, things like, car accident, lawsuits.
Mm-hmm.
The MLP also doesn't help with those. But I think what's important to know is if you are struggling to navigate one of those situations, we can provide referrals.
Right.
So while we can't represent you, we can certainly point you in the right direction, which may be all that you need to get connected to the appropriate person. We serve up to 200% of the federal poverty guideline, which is not a number anyone needs to figure out. When you call, like with our MLP, you would talk to Liz. If you called the intake number, you would talk to one of our wonderful intake specialists. You answer a series of simple questions, and then they will let you know if you financially qualify. Sometimes legal aid can't help because of a conflict, and what that means is that in some way or another, legal aid has either represented or advised the other party, or there's some reason why we can't help you. Again, if that happens, we're going to point you in the right direction. So I don't think there's anything that shocks us at this point. And there's certainly not judgment coming from us. We just want to point folks in the right direction. So we encourage you to have that conversation. I know the first call is the hardest one, but it's also the one that could change your life.
Yeah.
So please just give that call a try. And whether it's immediate legal help or resources, at least you're starting to walk in the right direction.
Yeah, and I think that reminded me of one of like the best things, in my opinion, about MLP is that we always try and provide at least some level of service. You know, so if you were to go through Legal Aid's general intake line, you would be subject to the case acceptance guidelines of the organization. If you are referred through the MLP, we don't have to stick with those strict case acceptance guidelines, and we always try and provide at least advice about legal issues that may not have made it through Legal Aid's general intake. And like Jen said, you know, even if we cannot provide advice for various reasons, we will always try and send referrals to either attorneys that can help or social service agencies or anything, so at least the person does not leave empty-handed, because we know that you know, going from phone call to phone call to phone call is exhausting. So we always try and make sure that, you know, the person leaves better than when they came to us in whatever way that looks like.
Yeah. Lastly, let's not forget to mention that this is free legal help.
Yes, that is a good thing to
because
remember.
how expensive would it be to fight this with an attorney that you had to pay up front? Yeah.
Yeah, right. I mean, depending on the case type, you could be talking about hourly rates more than $300, more than $700 an hour. And so we'd never ask for money. The only time that you may need to provide funding is filing fees, and we have fee waiver forms we have you fill out. So generally, no filing fee would be more than $10.
Yeah, well, that's great to know. Because the legal world is murky for most of us.
Right.
So unless you speak the language, it's very hard to come out where you, you know, benefit. Right. So thank you for the work that you all do at Legal Aid and the medical legal partnership side of things. Let's see. We are still here with Jen Kinsley Smith, senior attorney at Legal Aid, and Liz Latner, paralegal at Legal Aid. Allison has scooted out the door. Allison Jakubowski, social worker at St. Vincent Charity Medical Center. And Aaron Horan is creeping around somewhere in the background doing some kind of meeting, something. But, you know, getting things together to help people as a part of the Legal Aid team in communication. Thank you for joining us, and thank ladies in the room, and thank you to our listening audience for joining us. If you have any topics that you might want discussed about life and the law, in the realm of life and the law, TC, come on. You can send an email to the show, ovt@wovu.org. You can send a text to the talkback line or leave a voicemail, 216-200-7848, or during any live show. You can call us, 216-271-0959. This is Our Voices Today, and we are signing off. Have a wonderful time. Dina Davis is coming up next with the business breakdown. 12 o'clock is DJ Coco Z with the Power Hour Groove, and a encore presentation of Freedom Talk at 1 p.m. Have a wonderful time, Cleveland.
This is WOVU News Director T.C. Lewis with an important message from the Cleveland FBI. The FBI Cleveland Violent Crime Task Force and the Cleveland Division of Police ask for your help in the search for 27-year-old Raja Adriana McQueen. Raja was last seen June 26, 2021 near East 131st Street and Harvard Avenue. Her vehicle, a 2018 Nissan Sentra, was seen driven by an individual not Raja with bullet holes in the roof and rear passenger door. A reward of up to $25,000 is offered for information leading to the recovery of Raja or her missing 2018 Nissan Sentra. Raja is a black woman, 5 feet 6 inches tall and 133 pounds. If you or anyone you know have information about Raja Adriana McQueen, call the FBI tip line at 216-583-5383. That's 216-583-5383. You can remain anonymous. This message is brought to you by the Cleveland FBI and WOVU 95.9 FM. Our Voices United. Burton Bell Carr Community Radio.
Wow, I wish there was a way I could listen to WOVU when I wasn't in the city.
But there is.
Really?
Yes. You can go to WOVU.org. Go to our webpage. It's got everything on it, all the shows.
Eric Nolan is in the building.
This is Rachel Hill, the host of Her in the Huddle.
This is Delvis Valentine.
All listed.
Yo, what it do with your girl DJ Coco Z? Hey, I am Talitha Kube from Let's Talk About It.
Hi, this is DJ Black Unicorn.
WOVU.org. Tap the app. Listen live.
This is WOVU 95.9 FM, Burton Bell Carr Community Radio.